Hi, everyone. I'm Dr. Betsey. Welcome to our Push with Confidence webinar today. Reason that I have this training specifically and why I keep it free is because this was information that even as a pelvic floor physical therapist, some of this information I did not know my first pregnancy. And I think that this is something that we should all know so that we can walk into our labor feeling confident. By the end of this, you will have a PDF sent with some free resources for you, including how I teach perineal massage, because it is a little bit different than how other practitioners do teach you. I like to make it more functional. So you're leaving with some wonderful things that you can use after this training is over. If you have questions, I won't see them pop up, but I will save time for the end to answer any questions that you have. Now, we don't love to talk about perineal tearing, and I'm not here to scare you. What we're talking about today is going to help set you up in a way that you can hopefully prevent a severe tear from occurring. Why this matters is that we want to feel good postpartum. We want to have that time to bond with baby, but not also have to be taking care of a birth injury. Much is preventable. I want you to know what can you prevent and then what is uncontrollable. So what can we just kind of let go because we cannot grasp and try to control everything as we get ready for childbirth. But there are things that we can do to prepare ourselves. And that's what we're talking about today. So today we'll talk about what the perineum is and why it matters, the four different grades of tearing. Again, not telling you any of this to scare you, but to more give you the tools to prevent and avoid this. The number one risk factor for severe tearing and what you can actually do about this. There's so much that is in your power when it comes to this number one risk factor. And then my top 5 tips to protect your body during birth. We'll also chat about why birth partners are really important and why we should be training our husbands to really support us. So, Anatomy 101. Yes, I'm an anatomy nerd. I love anatomy. I'm a doctor of physical therapy, but this will be really quick and easy. I made sure that this is something that we can all understand, whether or not you loved science. So, the pelvic floor is a hammock. These muscles sit at the bottom of our pelvis, and they must stretch and get out of the way in order for us to birth the head of the baby. The good news is these muscles were designed to allow this to happen, but we have to teach these muscles how to get out of the way, how to stretch and allow space to accommodate baby rather than tighten and tense and not want to stretch. So it's not just the muscles themselves, but also the skin, the nerves, ligaments, and glands. There's a lot down there. These muscles are in charge of a lot. They help support our pelvic organs. They help us hold in pee and poop when we want to, and then they relax to fully let go. They help us to enjoy intimacy. And we want these muscles functioning well throughout life, especially once we get to menopause. So the perineum, this is the area that most commonly tears. It's that skin and muscle from the introitus, which is the opening of your vagina, all the way back to your rectum. This is the number one area at risk for tearing, and this is what we want to protect. And you have so much more influence over this than you might think. So the most common, thankfully, are grades 1 and 2. Grade 1, you're just tearing a little bit of skin. Grade 2, you're tearing into some of those perineal muscles that I just showed you. And then grade 3, we're starting to tear into the external anal sphincter. That muscle is really important to help hold in feces and gas. And that muscle, we do not want that muscle tearing. And then we get to number 4, that's when we're also tearing into the rectal lining. So my goal is really that we can avoid these 2, 3, 4 tears as much as possible. The reason this matters is that these are some of the symptoms that you can end up with if we don't prepare the pelvic floor appropriately. We end up having a tear. So you can experience any of these things. However, that doesn't mean that if you have a tear that you will experience them. As someone who was torn with my first birth and I have helped women heal postpartum, even if you do experience a touch of any of these symptoms, you can heal from them. But we don't want to have to deal with that, right? So that's why we're here today. So what can we control? What can we not control? We really can't control baby's birth weight. Yes, we can be healthy in pregnancy. We can be eating good food and making healthy decisions to nourish that baby well, but we can't fully control that. Sometimes we just end up with bigger babies. Maybe you are 6 foot tall and your husband's 6'5". You're probably gonna have a bigger baby. Genetics, we can't always really change our genetics. And then shoulder dystocia. Yes, there's some techniques that midwives and some doulas can help, like different positioning if that's happening, but we can't really control that scenario. We can't say, oh, if you do this, you definitely won't end up having that. And then there's something called the fetal ejection reflex. We call it FER. That's an extremely short questing stage where your body just kind of takes over and baby comes out quickly. Now, what we can control is your care provider's practices through communication. We can ask to avoid forceps and vacuum, episiotomies, and then we are in control of our birth position, how we push, and what we do to prepare. So, the number one risk factor for severe tearing is actually your provider. However, if you have a simple conversation with your provider and ask them to not do a forceps or episiotomy, because those two types of interventions can increase the risk of tearing. So, an episiotomy is where they do a small cut, but just simply introducing that cut can cause more tearing. And then the forceps is where they use an instrument to help pull baby, and that also can predispose us to those more severe tears. So, through communicating with your doctor, or your midwife, although we know that midwives are way less likely to use these types of instruments, so therefore they have less evidence of those types of tears occurring. It's still good to talk to whoever is going to be in your birth room. So that's something that you do have the power of. You can ask, what is your episiotomy rate or what is the hospital's? Usually in 2026, when we ask these questions, they'll say, oh my gosh, I can't even remember the last time I did one of those. But then there are some hospitals, there are some practices where they still are a little bit more hands on and they want to use these interventions. And that's where we simply need to have the conversation. We can ask them, what do you do to help prevent perineal tears? I would like to push without a breath hold. I'm going to do this. How do you feel? How do you feel about a hands off birth and a slow delivery? This is something that many of us don't know about. So be sure to stick through for the last tip. That's where we talk about the slow delivery. And then you want to recommend and ask for the position changes. Again, this is everything that's in your control. It's your birth. You are hiring that care team to keep you safe and baby safe, but how you birth and how you push and what that looks like for you is always up to you. Tip number two, move your body often during active labor. Now, if you haven't taken a birth class yet, so active labor is when we are getting closer to the end of dilation. So in the beginning, in early labor, 0 to 4 centimeters, you can be resting. Now, for the first time mom, I know that there's some first time moms here. When you start to feel those contractions or maybe your water breaks, we can feel like, oh my gosh, it's go time. Like we got to race to the hospital. But early labor is a time to actually keep our cortisol levels down. We want to be taking deep breaths, resting if we can, hydrating, eating nourishing foods, being cuddly with your husband, whatever it is that just helps you stay relaxed. You can even write down, this is what I want to do during early labor. But when you get to active labor, this is when baby's coming down and we are really dilating now. So when we move, it's going to help labor progress rather than stall. And even with epidural. So you can request wireless monitoring or intermittent monitoring. Now, every hospital will say we have our policies and procedures, but again, these are interventions that you can ask for. And again, this is your birth and your body, and you're able to say, I do not want continuous continuous monitoring. And then in that place, you're then more tied to the table and you can't move as much. So you can ask for different types. A lot of this comes to having conversations with respectfully with your birth team. Now, when we are lying flat through active labor, this can work against gravity. So, as you can imagine, if baby's coming down into your pelvis, if you're flat, now gravity's not really helping. When it gets time to push, if you're flat, it's going to feel harder to bring baby through the birth canal. And it can also increase your body tension. But it looks so much different when we are sitting on a birth ball. We're rocking back and forth. We're swaying or dancing with our partner. If you are in a hospital, you can walk the hospital floor if you're allowed to leave your room, which with my first birth in the hospital, it was a circle and I just walked and I walked and I walked and they had rails on the sides of the hospital floors and I could hold on and kind of rock back and forth. So those movements are so good and nourishing through active labor, but also listening to your body. You're going to rest when you need to rest. So this brings us to tip number three, optimizing your birth position. Now, the most common position we see in TV shows and in the movies is the mom flat on her back, and then she does a sit up and she's holding rails and she's pushing with all of her might and she's red in the face and she's tense. We have better options than that. That's the most dramatic way to birth. And is it effective? Yes, it is effective, but at what cost? At what cost is that the pelvic floor might not be able to relax and release, like we talked about in an earlier slide. And then what's going to win? Baby's head or the pelvic floor? Baby's going to come through. And then that's where we might have one of those tears because we were just having to like kind of push really hard through tension in the pelvic floor. These are some wonderful positions. And as you can see, many of these positions are okay to do with an epidural. You can be on your side. You can be sitting up with a squat bar. You can be reclined with an epidural. You're going to have your birth partner next to you. Sometimes they'll say, like, this isn't safe. You've got to be back, flat on your back. But that is not true. Even with an epidural, you can be in different positions. And then when it comes time to push, you can also say, hey, I want to be in a different position. So let's turn that epidural down. You can request that too. That brings me to tip number 4, no breath hold pushing as much as possible. So we call this purple pushing because people get so red in the face. And it's what many people in hospitals teach right off the bat. And it's not because they want to teach you, the least safe or the most severe way. It's because they see it's effective. But then we do have to heal from these tears that we get from this type of pushing. Are there women who do the breath hold push who do not tear? Absolutely. Absolutely. But what I want is for you to have different techniques, different ways to breathe so that you are doing the breath hold pushing. Hopefully not at all. But if you do have to do 1 or 2 at the very end, that's it, rather than using this as your only pushing tool in your birth toolbox, as we like to call it in the birth world. So the problem with only purple pushing by holding your breath, you are putting enormous pressure on your nerves, organs, and ligaments. Again, we want to protect our pelvic floor. This is a part of our body that really helps us have a fruitful life. We want to keep our pee and poo in. We don't want to be passing gas unless we want to pass gas, right? We want to be able to have control in that area and we want to feel good. We want to be able to have more babies. We want to feel strong when we get to menopause. It also depletes oxygen. So if you're doing that purple pushing, you're exhausting yourself. And you need energy at the end. When we finally get to the push stage, we don't want to go right to the type of pushing that will be exhausting for us. It can actually burst capillaries in your face. I had a mom who I did a one-on-one call with, and she walked out of the hospital with her firstborn with big sunglasses on because she had 2 black eyes because she held her breath and pushed so much that it burst the capillaries in her face. And so with her second, she was like, I really want a one-on-one call with you. I don't want that to happen again. And she was able to go through her birth in a much different way after we trained together. It can also increase your risk for some different dysfunction like hernias, diastasis, which is that abdominal separation, and prolapse. And it can cause those tissues to tear rather than stretch slowly. So, again, the pelvic floor is meant to stretch, but we need to be hydrated. So, drink your water during labor, and we need to be relaxed to help that muscle get out of the way. Now, tip number 5 is something I don't see talked about often enough. And this is so important: slow birth of the baby. So, rushing that final stage of pushing your baby out is one of the most common and preventable causes of severe tearing. So, what that looks like is, let's say the scenario is you have an epidural, so you can't really feel what's going on. So, they're looking on the monitor, they see a contractions coming, and then they're like, okay, now this is time to push. And so, baby's head is born. But then the contraction might end and they might say, no, keep pushing. Let's just get this whole baby out. But if that contraction ends, baby's not supposed to go anywhere. Remember, it's your uterus that's pushing the baby out, not your breath hold. So this looks like in practice that one pushing contraction would birth the head, and then you're pausing for maybe a couple minutes, waiting for that next uterine contraction. And that allows baby to do this rotation that needs to happen. And then full baby is born. So this looks like I would like to birth slowly, head with one contraction and body with next. Can you support that? This is so common in the midwife world. And a lot of OBs are on board for this too. But for some, it's not a practice that they're used to doing. So it's just having these conversations. And I love to have them in your prenatal appointments. Say, hey, I talked about slow birth of baby. I would really like to do this in 2 contractions. Can we talk through this? And I know that many OB practices, you don't know who you're going to have in the birth room. So it's good to just speak up and have questions because, again, this is a monumentous occasion. You are bringing life into this world. What a beautiful blessing that is. And it's okay to ask questions. It's okay to want to know what each OB's practices are and what their preferences are, and then you speaking what yours are. So these are your 5 tips. Knowing what to do and then executing under pressure can look like a couple different things. And I want to show you what I teach in my birth class that goes beyond just knowing this education and then putting it to practice. I like to say that the tip of the iceberg, like if I could have women walk away with anything, it's these 5 steps, these 5 different lessons. You know that you're going to move during active labor. You know that you're going to talk about not having some of those instrumental deliveries. You're going to be in different birth positions, not holding your breath. But is there anything that we can do to actually prepare our body to support these different theories that we've just talked about? And the answer is yes, there is. So I have a birth class called the Push Lab. It's the only birth prep course taught by a doctor of physical therapy who specializes in pelvic health. That's me. And this is my husband. He is also a doctor of physical therapy. He brings in his manual therapy and orthopedic expertise to teach the birth partners how do we actually bring mom's pain level down? What can we do with our hands through skilled touch to help her get through contractions? And then beyond the pain aspect, we do want our birth partner to understand what our preferences are so that if we're in labor land where we're just so in our body, we're trying to breathe through the contractions, we're just kind of in it, we need someone who can then speak to our nurses and the hospital staff and advocate for what our wishes are. Because almost all of us will get to a place where we feel like, I cannot talk to anyone, just like you help me, you help. And so that person needs to be able to help. So I love that my husband, as a doctor of physical therapy, can lend this expertise that you won't find elsewhere. We've had over 7,000 students take this course. We have a less than 1% severe birth injury rate compared to the 8% national average. And I'm so proud of that because I know that it's not just the education, but it's the actual preparation that the women do in the course with their birth partner. We go through 5 different modules. Women take this through their pregnancy. I've had women literally take it and read this information, watch the videos at 39, 40 weeks pregnancy. One mom told me that she had the modules open on her phone and her husband would watch my husband teach the birth technique, the hands-on technique, and then he would do it. And so they're just like learning in real time. I wouldn't say that's ideal, but it's possible. So I teach you how to transform your birth plan. So yes, we want to plan, but we don't want to be holding onto that plan so tightly. So I help you to really prepare to have your preferences, but be ready to go with the flow. Because as soon as something changes, a lot of us go into that fight or flight. And I don't want that for you. I don't want you, as soon as like maybe there's one little roadblock or one thing that you weren't anticipating, to completely shut down. And that's where our mindset and our spirituality come in. So no matter what you practice faith wise, it's so important to reach to something beyond yourself and to have a strong mindset because your body will follow what your mind is thinking. So you can be the most fit, healthiest person. But then if your mind just panics in the birth room, your body will follow. And we would just want to stay out of that fight or flight as much as possible. And there's so much that you can learn to do so. The pelvic floor prep is important. I love teaching women not only how to like understand those muscles, but then we go through how to train the muscles to relax with different types of pushing in different types of positions. So breath directed pushing is so important, but we need to know what's your best push position. Is it on your side? Is it reclined? And then how can you know? How can you sense what's going on with your pelvic floor and then practice that? So when you get to labor, whether or not you have an epidural or not, you will feel confident just going through these pushing techniques and these breathing techniques, trusting that your body knows what to do, whether or not you feel it. And then we want your birth partner to know how to coach you through the labor breathing. So not just through the pushing breathing, they should understand that, but they should understand what you need in early labor and active labor and transition, because many of us are not hiring doulas. And even if you do have a doula, your birth partner, who's and presumably is thinking is your spouse, they know you best and they know how you perform under pressure. They know your weaknesses and what can really get you triggered. So they can be there to help protect you and guard you and have some tools in their toolbox to do so. Because this is a new experience for them too. So most birth courses don't train the partners, and we do. It's one of the biggest things that we do. And I've kind of talked through all of this already, but we really want your partner to feel like they can support you in the way that you deserve. So you get the 5 course modules. You also get a complete birth prep exercise library. This is so important. You can start in your first trimester. You can do it for a few days right before you go into birth and you want to learn how to understand what's going on with the pelvic floor. You get the birth partner boot camp with my husband, and we have a push lap community where you can come in and ask questions. And the perineal massage video tutorial, excellent for first time moms. I know a few of you are here. The research isn't as great if this is your second or third baby. Sure, you can add it in, but I wouldn't say it's like the most important piece. It's more important to understand how your pelvic floor is responding to your breathing and keeping your body hydrated and keeping your hips, your low back, and your pelvis primed for labor. And then I give you some postpartum guides. So if you ended up having a cesarean, we have a healing guide there. And I also walk you through your choices. Should it turn into a cesarean birth, you'll have some education there. So you know what you may or may not want. Constipation management guide, because after we have babies, we do not want the first bowel movement to be painful. And then a returning to intimacy guide, which I think is very important, especially if you've had either a C-section or a vaginal birth. So all that is yours. I'm offering a discount. If you are interested, it goes from $197 to $130, and that is for 48 hours. I have today only, but you have a couple days because it's important to sit with it and to decide what is the best course for you as you are getting closer to your due date. A couple of moms here have excellent testimonials. On my Instagram, you can read hundreds of other ones, but there are women who have had that severe birth tear and then take my class and they don't have any tearing the second time around. Many moms have said that their birth team was so surprised that they were a first time mom, and my favorite is of all time was a pediatrician who took it, and she said it's a beautiful balance of evidence-based education and excellent pacing with a faith-filled and mindset component too. So we've got to bring in that psychology as well. So some other birth classes that are very popular. So going to the hospital. This is great if you want to get the tour, if you want to know, what the procedures are, what the instruments look like, but you're not going to get these different categories. Hypnobirthing. I do like hypnobirthing soundtracks to just kind of listen to and get you in the mood, but they're not going to go through the partner training. They do the mindset training to a good extent. There's a bunch of free hypnobirthing apps you can download. I think the music is beautiful. I don't love the idea that if you get into a hypnobirthing mindset that you'll have no pain because women who think that they can have a pain-free birth, the moment they feel discomfort, they can kind of shut down and think, "And I'm doing something wrong because this isn't pain free." And so I don't love that theory. Some women do have pain free births. I think it's more important to set up the mindset for this might be hard work, but I am strong and I can do it. And I will have tools to manage that pain and I won't run from it. I'll know how to lower it and I'll know how to persevere through this. The Bradley method is also a wonderful class. They don't have that holistic partner training that we are very proud to offer you with my husband and myself training it. So with the Push Lab, you get all of it, which is so great. So with code Birth Ready, I can enter in the chat the course. If you want to sign up, you can read through the landing page that shows all of the information. I really pride myself in really being available to my students. This isn't something that you sign up for and never hear from me. I am available to you on email within the community. And if someone's ever really stuck, we're not just going to keep emailing back and forth forever. I'm going to hop on a call and help you. So here's some questions you might have. I already have a hospital birth class. Do I need this? I would say after that slide, I think that there's a lot of tools in here that can help you. Is it for you if you have an epidural? Yes, because if we train our body for birth and we have that beautiful connection between our mind and our muscles, even if we don't feel what's going on down there, we can be confident that the pelvic floor is relaxing with the type of pushing and the type of exercises that we've prepared for ourselves. If you feel strapped on time, you can get through this quickly. You can digest this information fast and you can start preparing your pelvic floor every night before you go into labor. It doesn't take much to do some simple stretches. You have lifetime access. That's really important to me because I know many moms want to have multiple kids. And the difference of my birth class compared to others is that it's just not education, it's a method. I'm taking you through these exercises each time. We're training our mindset each time because you will be a different woman as a mom to two, as a mom to three, and we'll have to kind of meet you where you're at each time. So you have it for life. And again, my promise is like, this is just my pride and joy, this class. And I'm here to help you. I'm always available to make sure that you feel confident going into your birth room. So again, this price is for you for 48 hours. And then in your inbox, you'll have the freebies I talked about. It's all in one PDF. So you'll open it, you'll have your provider question handout, you'll have your pelvic floor prep checklist, and then there will be a link that you click that will take you to this perineal massage video. So you won't be getting a video emailed to you. It's all in one PDF right there for you. And that just is the simplest way to do it. I am really excited for all of you. Whether or not you need my birth class, I hope that this information was helpful. Remember that conversations frequently and often with your birth partner and with your care team is going to set you up for success, and that there's a lot that you can do to have a beautiful birth. And if you need some hand holding through that, I'm here if you need me. I'm not seeing any questions come in. So instead of keeping you guys on, I'm going to say goodbye. But I do see a question. When should I create a birth plan and what should be in the birth plan? This is such a good question. So there are many different things that you want in the birth plan. And I take you through that. It's an entire module in my birth class. So I'm taking you through it all. And I think I like to call it birth philosophies because we might say, I'm going to have an unmedicated birth. I'm going to do this, this, and this. But then things can change. And so it's good to just know all of your options and to have it written out. So when you sign up for the Push Lab, you have a workbook where you can fill out the birth plan yourself and then you can talk about it with your partner so that you're both on board. Taylor says this is super helpful and reassuring already. I am so happy, Taylor. Thank you for saying that. I want you guys to be reassured that this is one of the most beautiful things you'll ever go through, and every birth is different. So if you came here, maybe you had a traumatic first birth, that does not mean that this is going to happen again for you. It can be a beautiful one, and just having the right support is so important. And I think that I will just be thinking of all of you. I can't wait to hear how your birth goes. So please, if you took this class, this training, come back into my Instagram DMs. I can type in my Instagram right here and let me know how it went. I want to know. For the birth positions, lying flat is not recommended at all. Well, I think it's good to know which position your body relaxes in the most. And the problem with being completely flat is that now you have to use your breath to help baby through the birth canal because you no longer have gravity at this point. So when you're more in a more upright position, gravity is helping. And again, we want that steady pressure from gravity because that's helping with dilation and then it's helping the pelvic floor muscles slowly stretch. That's not happening as much lying flat. So I would say it shouldn't be our number one position. There are women who end up having a very long labor and they are very tired and they end up on their back. If we could add a couple pillows under our back, if we could come onto our side, we could just change that completely flat back position a little bit. We can elevate that hospital bed. That can make a difference too in how we're birthing. I think that it's the number one position that you see, and it's one of my missions to let women know that there are better options than that. Okay, you guys, these were good questions. All right, you guys, mamas, have a wonderful night. I'm here if you have questions. Keep an eye on your inbox for those freebies. They are sent out automatically to you. So if you don't get it, either it went to your spam. If you've gotten all of my other emails and you don't get that one, it went to your spam. And if you don't see it by tomorrow, just send me a message and I'll be sure to get it to you. Okay? Take care, everyone. Thank you so much for being here. Bye.